like to invite Dr. Umabathy back to the stage.
So I'd like to remind once again that this is just a 12 weeks program, and they all did this in 12 weeks. Some of them have gotten better with cleaning the data and working with the messy data. Some of them have gotten better with asking right questions. Some of them have gotten better with figuring out the right analysis to do. Some of them have gotten better with helping our client understand and interpret those analyses. Some of them have got better with doing data mining stuff. Some of them have gotten better with writing a report that the executives can read it and understand it. Some of them have gotten better with doing visualizations. Some of them have gotten better with developing dashboards. So all of this, they pretty much came with very basic skills, don't having skills on it, and they will be able to achieve this. And all of these are the needed skills of being a data scientist. So in this case now, we have 12 people who have become a data scientist today. So let's congratulate them. Right, so with that, we're going to move to the next stage in our event. So I would like to invite all of our clients to come in. Josie, Dawn, Amy, Jess, Akisha, please come to the stage. So let's give big hands for them. We are here, we have this problem, and we have this opportunity. It's all because of them. So let's give them big hands and welcome them in. Let's stand. Right, so they're going to reflect on essentially 3 questions. So first question is, what's the biggest big reveal for them from their organization point of view? And the second question is, what is the value that adds to their organization? And the third question is, how are they now going to move forward with that information they have in here? So I'm going to make them line up once again so that they will be able to easily pass the value. Mike, you can stand here. Don, come next to Josie. Amy, can you stand next to the, so that it will be easier for you guys to pass on the mic. So I'm going to pass it to Josie.
So the perspective that I had personally and organizationally was that, well, it was always been a dream of mine to take what our students do and to make it somehow more valid, more than just getting a gold star and going, yay, we did this thing, but to actually show that our students can collect valuable data and that they can actually contribute to research that we do. So I think it's really important to have everybody, as many of your community members as possible, participate in what you do.
Hello, I'm Dawn with Starting Point Behavioral Healthcare. I have notes. We just want to thank these guys for taking the time to work with us on this program. We want to thank UNF and this team because we are care coordinators, we're social workers, we're therapists, we're admins, we are not data collectors. So I know they had a challenging project ahead of them with us, and they did such a fabulous job. They've been extremely helpful and knowledgeable in helping us collect and analyze the data from our care coordination program to address the opioid crisis in our community. The data shows how impactful this problem is on our community, and we've learned how to better identify our high utilizers, where they live, and the factors that contribute to those who are most at risk. So once these high utilizers are identified, the project also showed us who is more likely to re-enter time and time again for treatment, contributing to recidivism. This information is crucial since our goal is to ultimately reduce recidivism rates and connect people with treatment. This information helps make an impact by addressing the needs of our community, and it helps us to know where to focus our efforts and at what capacity our services are needed. We know we are a small organization, and to meet the needs of our community, Starting Point is currently working with the Health Planning Council on a grant to address the opioid epidemic in Nassau County. So this data will go a long way to helping us with that. because it gives us the tools that we need to be successful, such as an individual timeline from a person's intake to their treatment or lack thereof, and how simple things like face-to-face contact versus a phone conversation could make a difference whether or not they recidivate or have a successful outcome. So thank you again to UNF and Florida's Data Science for Social Good program for choosing to work with Starting Point on this wonderful project. You've not only validated our efforts by showing us that our care coordination program works, but you've also shown us how we can make this program even more effective in our community. So thank you.
I'm Amy Lohr from the Children's Services Council. I also wanted to take a moment to thank Karthik and Dan just for the existence of this program, and to the team who did an outstanding job under all the constraints of time and the volume of data and everything that we at CSC face. One of the takeaways, and it was the bullet up there, was just the knowledge that being a participant in these services is better than not, and that we're targeting the right population of high-risk people in the community. I think that in the organization that we all have this sense of we're doing good work and we're making an impact, but we don't always have the opportunity to see at a global, a macro level, because we do a lot of program level analysis, but at a macro level in our systems and everything that works together, that we're actually making an impact that you're showing here, which is just it's really important to know that. Personally, professionally, and also to our stakeholders, our residents, stakeholders, because we are accountable to the residents of Palm Beach County taxpayers. So being able to tell that story, that we're making wise investments, is very, very important. In terms of actions and what we can do, I think the knowledge around the targeting of high-risk people in the population and understanding the levels of risk and the types of risk and how these interact with the services that we provide, and the dosage levels, the potential dosage levels based on these different levels of risk and characteristics of the participants that we serve. I think that's really, really important moving forward. With these sorts of things, we have a lot more questions, and we wish we had so much more time to get into those next questions. But it's actually something that we will be carrying forward, because we do have an evaluation team that we can continue this work and hopefully reach out from time to time to get some help and support. But again, we're just so thankful for this opportunity. It was a great experience.
Hi, good evening. I'm Jess Goodkind with Phoenix, Northeast Florida, and just to repeat what everyone else has said, an immense thank you from our organization to all of the students and the professors and everyone who worked on this project. It has turned out to be something so much bigger than we ever could have imagined when we first started this. I have to admit, when I first started writing the proposal for this, it was a little bit of a selfish endeavor. I had been hand drawing maps, trying to consolidate all the different aggregate levels of data in the only way that I knew how, and it was taking up a lot of my time, and it was very, it was annoying. And so I wanted to create something that would be useful for everyone in our organization, and the fact that all of the students were able to make that into a reality for us, for our department, and then turn it into something that could be used by all the departments in our organization. It was just beyond what we had originally envisioned, and I just think that's incredible. From an organizational perspective, having all of this consolidated data is going to make such a difference in the way that we strategize and the way that we make decisions at Feeding Northeast Florida. We have a limited amount of resources, and we have a lot of hungry mouths to feed. There are just hundreds of thousands of our neighbors who don't have enough food to eat. They don't know where their next meal is coming from every day. And over 75,000 of those are children. And having a data tool like this, where we can zoom in and we can see the exact need in the exact community, and be able to, in my department, write a grant that describes that to our potential funders, or in some of our more hands-on departments in the operations department, know, okay, maybe this is where we need to be redirecting our newest program, or this is where the seniors are living that we've been trying to reach but couldn't figure out where they were before. That's going to be so meaningful for us, and it's going to really make a difference in our community. for the next steps with this new tool, we are really, really excited after this event to be able to share our new dashboard with all of our stakeholders, with our board, with a bunch of the executive team and the management teams within our organization, and get everybody on board with it, teach them how to use Tableau, teach me how to use Tableau better, and then hopefully be able to find new applications for it and ways that we can incorporate it into our everyday processes at FE Northeast Florida. So again, a huge thank you to all of you, and we are so excited about the future of our partnership with your university and with each of you. Thank you.
Hi, I want to say thank you again to the UNF team for all that they've done over these last 12 weeks. It was amazing working with our interns, Kevin, Amitabh, Brianna, and Nick. I think from our organization standpoint, the most significant finding during this project is that the arts continues to add up for students. The arts adds up to increase attendance rates, the arts adds up to improve GPA scores, and the arts adds up to improve standardized test scores, which can all help increase graduation rates and help students become better equipped for higher education and perform and excel in professional settings. The impact of the program for our organization will help the Cathedral Arts Project to continue broadening our reach to ensure that all students in Duval County have equitable access to arts education by advocating and informing others about how the arts add up for our students. The next steps would be to continue evaluating our programs to make sure that we're improving our direct services to make sure that students have the optimal outcomes that we would like to see. And we look forward to sharing the dashboard with our stakeholders to show them the benefits of arts education.
Thank you. So it does take courage to write a proposal and ask for help, and they did that, and because of which they are here too. So again, thank you for submitting the proposal, and thank you for giving wonderful problems. So please, let's do one more round of applause for them.